Welcome to Best of the Pharmacology 25 Must Know Questions. Well, these questions are most commonly tested in the board exams and therefore those considered as must know questions. And many questions, for obvious reason, answer looks one answer. However, correct answer can be different. So let's start looking at those questions. First, which of the following medication require an auxiliary label avoid consumption of grapefruit juice? A. Rosuvastatin, brand Crestor. B. Felodipine, brand Plendil. C. Lisinopril, brand Zestril. And D. Losartan, brand Cozar. And for obvious reason, this question looks like a very straightforward, and some of you may feel like this question, you often see that in many question banks. However, answer is not the exactly same that you expected. That's what the trick of this question. That means you have to pause this video and think what is the best answer. That's what how many questions in the board exam they are tested such a way that for obvious reason one answer looks correct, but that may not be the best answer. All right, so here the best answer is felodipine. I know as per our survey, most students thought the correct answer is rosuvastatin, Crestor, but that's not the best answer. The reason why, because all statins does not require cytochrome 3A4 enzymes to require substrate. Only three statins such as atorvastatin, simvastatin, lovastatin are substrates of CYP3A4 enzymes. Therefore, those are the three statins. I repeat, atorvastatin, lovastatin, simvastatins required to avoid consumption of grapefruit juice. However, rosuvastatin is not metabolized by CYP3A4 enzyme. That's reason one can still use rosuvastatin and also consume grapefruit juice. However, felodipine, which is a dihydropyridine type of calcium ion channel blocker, that is a strong substrate of CYP3A4. Therefore, it can affected their metabolism is affected by consuming grapefruit juice while taking this medication. That's the reason why you label it as a avoid consumption of grapefruit juice for felodipine. Next, a patient was prescribed oxycodone for post-surgical pain. The pharmacist wants to advise on preventative measure to manage opioid-induced constipation. Which of the following measures should the pharmacist recommend? A. Increase fiber intake. B. Begin stimulant laxatives such as Senna or brand Senocot. C. Start bulk forming laxatives such as Cilium or brand Metamucils. And D. Start an asthmatic laxative such as lactulose. Guess the best answer. I know it sounds like a increased fiber intake also appropriate, but what is the most appropriate measure? The best answer is begin stimulant laxatives such as Senna, because Senna is used a laxative, which is a stimulant laxative used for preventing opioid-induced constipation. So whenever you initiate opiates such as oxycodone, often given with Senna or Senacot to prevent constipation that can be induced by opiates. Opiates' common side effect is opioid induced constipation. That can be prevented by using Senna along with oxycodone. Next, a CK is 50-year-old male presents a new prescription of Allopurinol for long-term uric acid control. CK is counseled at pharmacy before starting therapy. Which of the following is the most important counseling point the pharmacist should emphasize? A. Avoid dairy products or calcium within 2 hours of each dose. B. Report any skin rash or itching to the healthcare provider. C. The medication can take after meal to reduce GI side effect. And D. Limit the fluid intake. I know, as usual, many questions answers looks more than one answer correct answer, but only one best answer you have to select. That's the trick of the board exams. So here, for example, the best answer is report skin rash and itching to the healthcare provider. Allopurinol has a known hypersensitive reaction that is known as allopurinol hypersensitive reaction, especially in genetic polymorphism, HLA genes. Patients who have those have higher risk of skin rash. So, therefore, all patients who receive the allopurinol require counseling from the pharmacy about that. Any case, if they experience any skin rash or itching after start taking this medication, should definitely report to the healthcare provider. So that's the reason why that's the best answer. Next, a patient has been taking rosuvastatin for high cholesterol and report muscle soreness and weakness. The pharmacist suspects statin-induced myopathy or muscle toxicity. Which lab test results would confirm that patient is experiencing statin-induced muscle damage? A. Elevated AST and ALT. B. Elevated creatinine kinase. C. Elevated serum creatinine. D. Decreased LDL cholesterol. Great. So after start taking rosuvastatin, you will see many changes. You may see most lab changes here, but question the keyword is what lab test is indicates it is a muscle toxicity caused by statins. First answer also sounds correct, but the best answer is elevated creatinine kinase is a sign of muscle toxicity caused by statins. Whereas statins also can elevate liver enzymes such as AST and ALT, and of course, they also decrease cholesterol. But the question is specifically asking what test is used for diagnosis of the statin induced myopathy. Next, a patient with heart failure is prescribed digoxin furosemide. During follow up assessment, healthcare team evaluates the patient lab results and symptoms. Which of the finding would increase the patient risk of developing digoxin toxicity? A. Serum potassium level of 3 millimoles per liter. B. Serum sodium level of 140 millimoles per liter. C. Serum potassium level of 4.5 millimoliters. And D. Serum magnesium level of 2 millimoles per liter. The best answer is serum potassium level of 3 millimoles per liter, which is considered as lower level of potassium, also known as hypokalemia. In case of hypokalemia, patient taking digoxin and also combined with furosemide, which also cause hypokalemia, together can increase the risk of digitalis toxicity. So, therefore, the lab test serum potassium level less than 3 or 3 millimoles per liter is considered as dangerous sign which can lead to the digoxin toxicity. Next, DJ is 30-year old and newly prescribed lithium carbonate for management of mood disorders. At the pharmacy, pharmacists counsel before initiating therapy and review the key lifestyle monitoring consideration. Which of the following is a counseling point most important for pharmacists to emphasize? A. Reduce fluid intake. B. Reduce sodium or salt intake. C. Increase fluid intake. And D. Maintain a consistent salt intake or hydration. The correct answer is maintain consistent salt sodium intake with dehydration, because low sodium diet or significant lower sodium or salt intake can increase the lithium toxicity. So therefore, Patients should be advised to maintain consistent salt intake and hydration. Next, KP is a 70-year-old male with chronic kidney disease, that is, creatinine clearance is 29 mils per minute, and had gout. He had his last gout attack 2 months ago. Today he presents with a painful red swollen toe consistent with an acute gout flare. At walk-in clinic, he is prescribed naproxen 500 milligram twice daily for 5 days. His current medication include levothyroxine, liraglutide subcutaneous daily. What drug therapy should pharmacists identify for KP? A. Naproxen and levothyroxine should be taken on empty stomach. B. Naproxen should be avoided in patient with a renal dysfunction. C. Naproxen should be avoided in patient taking liraglutide. And C. Naproxen should be taken with food. Correct answer is naproxen should be avoided in patient with renal disease. So here in the case scenario says patient creatinine clearance is less than 30, that is 29. So when there is a patient creatinine clearance less than 30, which is called severe renal disease, in that case, all NSAIDs such as naproxen, brufen, all other NSAIDs are contraindicated in patients who are having creatinine clearance less than 30. So therefore, this patient cannot use naproxen for pain. However, pharmacists have to consult the healthcare provider and change to the different pain medication. Next, JD was diagnosed with peptic ulcer due to H. pylori infection and prescribed clarithromycin, amoxicillin, metronidazole, omeprazole, and JD's current medication include atorvastatin, empagliflozin, metformin, levothyroxine. And what is the most appropriate action for pharmacists to take? A. Dispense as prescribed and monitor closely. B. Contact the provider to suggest regimen without clarithromycin. C. Counsel patient to stop using atorvastatin for 14 days. D. Switch atorvastatin to pravastatin for duration of therapy. The correct answer is contact the provider to suggest regimen without clarithromycin. Because there is a drug interaction, serious drug interaction between patient current medication, that is atorvastatin, and this clarithromycin. These two medications should not be given together because atorvastatin is a substrate of CYP3A4 enzyme, whereas clarithromycin is a inhibitor of CYP3A4 enzyme, which can result into serious drug interaction. That's the reason why there is a two regimens. One regimen of quadruple therapy for H. pylori, one with the clarithromycin, and other one has no clarithromycin. So therefore, this regimen could be appropriate for patient taking statin therapies. Next, a pharmacy technician alerts pharmacist for prescription of antibiotic sulfamethoxazole trimethoprim for the patient with a history of A. Penicillin allergy, B. Sulfa allergy, C. Aspirin allergy, and D. Peanut allergy. Correct answer is sulfa allergy. Sulfamethoxazole trimethoprim or which is SMX-TMP brand Bactrin, or belongs to the sulfonamide class of drugs. So therefore, they do cause cross allergy with those drugs that has a sulfonamide group, like class allergy with sulfa groups such as antidiabetic drug, glyburide, and all those other medications, or COX-2 inhibitor, celecoxib, also has sulfonamide group. All the drug that has a sulfur drugs or COX-2 inhibitors, those drugs have a sulfonamide group, and also antibiotics, SMX-TMP, they all have a cross allergy to sulfur. So therefore, patients who have a history of sulfur allergy, they should avoid taking this medication. Next, which of the following is the most active form of vitamin D? A. Dihydrocholesterol. B. Ergocalciferol. C. Cholecalciferol. And D. Calcitriol, which is a 125 dihydroxycholecalciferol. Correct answer is calcitriol. Calcitriol is the most active form of vitamin D compared to other vitamin Ds available, such as vitamin D2, such as ergocalciferol and cholecalciferol. The calcitriol is the most active form of vitamin D. Next, a client presents to your pharmacy with concern of eye pigmentation or staining in the eyes. His current medication include metformin, glycoside, timolol, latanoprost. 1 year ago, he had a cataract surgery and used ophthalmic antibiotics, dexamethasone eye drops. Which of the following medication side effect could be associated with this concern? A. Timolol. B. Dexamethasone. C. Latanoprost. D. Ciprofloxacin eye drops. Correct answer is latanoprost. Latanoprost is a prostaglandin analog. These medications have a eye pigmentation and also eye lengthening of eyelashes side effect. So these are the reason why this patient might be getting those eye pigmentation side effects. Next, which of the following medication associated with gynecomastia? A. Prednisone. B. Finasteride. C. Eplerenone. D. Phenytoin. Correct answer is finasteride. Finasteride is a androgenic antagonist drug or testosterone antagonist drug which causes the enlargement of breast side effect, which is called gynecomastia. I know there are other drugs are very famous for this, such as spironolactone is another drug known to cause gynecomastia as well. But in the given answer, that's the best answer because there is no option of spironolactone. Next, clobetasol is a topical corticosteroid. What is its potency? Low potency steroid, medium potency steroid, C. High potency steroid, and D. Very high potency steroid. Correct answer is very high potency steroid. Among the steroids, topical steroids have a various potencies. Like clobetasol is considered as high potency steroid. So very high potency steroid because this is known to cause severe side effect if it is applied on the thin skin. Therefore, these steroids generally applied on the thick skin areas of the body, whereas the low potency steroids such as hydrocortisone, desodonide, those are considered the low potency steroid. They're often used on this facial areas of the skin. Next, Tirzepatide brand Muniaro is the best classified as a which of the following? A. Selective GLP-1 receptor agonist. B. Dual GIP GLP-1 receptor agonist. And C. DPP-4 inhibitor. And D. SGLT2 inhibitor. The correct answer is dual GIP GLP-1 inhibitor. Tirzepatide act as a both receptors of GIP and GLP-1, which is distributed on intestinal endocrine cells, and by enhancing their effect, increase the activity of incretin analogs, incretin hormone, which activate the secretion of insulin from pancreatic beta cells. So therefore, this is a unique mechanism compared to other class of drugs such as liraglutide, semaglutide. They only act on GLP-1 receptor, whereas this is the one that has been found to affect on both of them. One is a GIP and GLP-1. Therefore, this medication currently used for treatment of type 2 diabetes, and also it also has a weight loss side effect. Therefore, it is also used for weight loss as a off-label use. Next, a breast cancer patient tests positive for HER2 overexpression Which therapies specifically target HER2 positive breast tumors? Knowing HER2 state is critical for guiding this breast cancer therapy. A. Tamoxifen. B. Pembrolizumab. C. Trastuzumab. D. Anastrozole. Correct answer is trastuzumab. Trastuzumab is selectively act on the HE2 receptor breast cancer patients. So therefore, there are different types of breast cancer positive tests, such as estrogen receptor breast cancer. Then you probably use tamoxifen, whereas postmenopausal women you go for anastrozole. But if it is a specific breast cancer that is guided by HER2 status, then trastuzumab is a unique drug. Brand name is Herceptin, is used for treating HER2 receptor breast cancers. Next, a patient with slow metabolizer of CYP2D6 enzyme has been prescribed codeine. Which of the following could be possible appropriate outcome? A. Increase efficacy of codeine. B. Decrease efficacy of codeine. C. No effect on the efficacy of codeine. And D. Increase risk of adverse effect with codeine. Correct answer is decrease efficacy of codeine. Well, codeine is metabolized by CYP2D6 enzyme, and this CYP2D6 enzyme is essential for codeine metabolism because codeine become active drug morphine by this enzyme. However, this enzyme has a genetic polymorphism. That means some group of patients are slow metabolizers of 2D6 enzyme. So, if patient those who are identified or screened as slow metabolizer of CYP2D6 enzyme, then if they take the codeine, they will have a reduced or ineffective conversion of codeine to morphine, results in decreased efficacy of codeine and cause less pain relief. A patient receiving a chemotherapy regimen containing cisplatin, which of the following is a significant side effect? A. Hemorrhagic cystitis. B. Ototoxicity. C. Cardiotoxicity. D. Hand foot syndrome. The correct answer is ototoxicity. Cisplatin is an anti-cancer drug known to have a three major side effects. One of them is ototoxicity, means toxicity in the hearing problem can happen. And also, cisplatin can cause severe, very high nausea, vomiting class of drug. And additionally, it is a nephrotoxic that can be dangerous for kidneys. Next, which of the following antidiarrheal medication may cause blocked stools and tongue as an adverse effect? A. Loperamide. B. Bismuth salicylate. C. Cilium. D. Restolax. Correct answer is bismuth salicylate, that is known for antidiarrheal drug, over-the-counter drug, and are known to cause side effects such as blocked stools and tongue color changes. 8-year-old with allergic rhinitis is taking cortisones, which is a intranasal inhalers such as fluticasone. However, he developed new dark, irregular patches on his back. What could be the disease? A. Skin melanoma. B. Fungal infections. D. Hyperpigmentations. D. Melena. Correct answer is fungal infections. Because patient taking cortisone or an intranasal inhaler such as fluticasone or budesonides, they often has side effect of immunosuppression, which can result into fungal infections. So best answer here is fungal infections. Next, a patient presents to pharmacy complaining tinnitus, that is ringing in the ears, persistent headache, and episodes of nausea and sweating. On review, you found that patient has been taking large dose of aspirin for chronic pain over several days. These symptoms most indicative of the which following toxicity effect? One is aspirin allergy, B. Acetaminophen toxicity, C. Salicylate toxicities, D. Acetaminophen allergy. Correct answer is salicylate toxicity. Salicylate toxicity can cause tinnitus, which is a ringing in the ear, or headache, or nausea, warmth, or sweating. Which of the following drug is most likely to exhibit the phenomena of disproportionate increase in plasma level with small dose change? A. Warfarin, B. Phenytoin, C. Digoxin, D. Carbamazepine. Correct answer is phenytoin. Phenytoin is having saturated pharmacokinetics. That means after a certain higher increase in the dose, it can metabolism can saturate and result into phenytoin toxicity. So therefore, disproportionate increase plasma can happen in increases in the sudden increase of phenytoin dosages. So therefore, phenytoin dose increment have to be done gradually and with the small dosages to avoid any disproportionate increase in plasma concentration of phenytoin and which can cause phenytoin toxicity. Next, Detamir, the brand Levemir, insulin is used once daily as a subcutaneous injection. It is a rapid acting insulin, or B, regular insulin, C, intermediate acting insulin, and D, long acting insulin. Correct answer is Detamir. Levemir is a long acting insulin which is similar to other long acting insulins like Glargine, Lantus, and also Degludec, which is another long acting insulins. Next, a patient visits the pharmacy complaining persistent dry cough along with sweating, tremors, high fever. The patient mentioned they have been taking over the counter medication to help relieve their cough. The pharmacy profile shows patient is currently taking sertraline, the brand Zoloft, for depression. Based on the symptom medication history, which of the over the counter patient most likely taking it? A. Diphenhydramine, B. Loratadine, C. Dextromethorphan, D. Guaifenesin. The correct answer is dextromethorphan. Dextromethorphan is cough medication used for dry cough, and when it is combined or taken along with antidepressants such as SSRIs or MAO inhibitors or tricyclic antidepressants, they can result into condition called serotonin syndrome. Serotonin syndrome is a type of drug and drug interaction which enhances the serotonin level in the synapse and which can result into excessive activity of serotonin, and that can result into serotonin syndrome symptoms such as fever, tremors, sweating, and can also cause CNS confusion, other symptoms. So therefore, pharmacists should advise patient to stop taking dextromethorphan and refer patient to healthcare provider. If pharmacy technician detect prescription interaction, pharmacist technician should refer patient immediately to pharmacist. Next, a 55-year-old patient newly diagnosed with solid tumor undergoes first cycle of cytotoxic chemotherapy. After infusion, monitored closely for side effect. Which of the following side effects typically occur 1 to 2 weeks after starting chemotherapy in patient with solid tumor? A. Nausea, vomiting. B. Cardiotoxicity. C. Neutropenia. D. Hemorrhagic cystitis. The correct answer is neutropenia. Neutropenia is the common side effect of most chemotherapies. Generally, that occurs in the first, second, around 10 days or 1 to 2 weeks after taking this chemotherapy. And neutropenia, also known as here bone marrow suppression, which can result into severe symptoms of fever and signs of infection. So therefore, patient required to be monitored for white blood cells count to check the neutrophil count to see if the neutrophil number goes down, then it is referred as neutropenia. Next, WS is a 30-year-old healthy male presents to pharmacy really for allergic rhinitis. He asks for a recommendation on oral non-sedating antihistamine so that his daytime alertness is preserved, and he has a job that requires alertness. Which of the following antihistamine should the pharmacist recommend? A. Pseudoephedrine, B. Loratadine, C. Hydroxyzine, D. Diphenhydramine. The correct answer is Loratadine. Loratadine is a second generation antihistamine, that is non sedative antihistamine. So, therefore, this is the first line choice for allergic rhinitis, especially if you're looking for non sedative antihistamine. All right, with this information, these 25 questions are most frequently tested questions. So, therefore, every student who are writing board exams must know those questions and then why those answers are the best answer. However, in the exam, you may not expect exactly same type of question, but these questions are similar and can be inspired from this question and prepared for your board exam. So, to get to know more exam questions, more preparation for your exams, stay tuned and subscribe Pharmacy Prep channel. And until then, thank you.